go ahead now and take you over here to a guest here who's joining me on the desk to talk a little bit about breast cancer awareness. Miss Judy Taylor, welcome in here to East Texas Now.
Thank you for having me today.
I'm so glad you're here. So we get to kind of chat a little bit. Obviously, breast cancer awareness, it's very important for women to understand what that means, whether you are, a survivor of breast cancer or you just want to be aware of the dangers of it. So October Breast Cancer Awareness Month, and there's a lot of emphasis that's put on mammograms up. Why are mammograms so important?
Well, mammograms are the golden standard for for early detection of breast cancer, and by getting your annual screening mammogram, you are able to detect breast cancer earlier, and you're able to treat the breast cancer, and your survival rate is increased by getting your mammogram.
It's obviously important for most women, but for those that have never had a mammogram, what is kind of that process?
Well, the patient is checked in and they are prepped. They usually have to remove their clothing from waist up. They put a gown on and they are examined. We take 2 images of each breast, and the mammography technologist reviews the images. They're sent to the radiologist. The radiologist, he interprets the mammogram, and then if everything is normal, then they will receive a screening follow-up. But if there is something there that is suspicious, the patient is called back for additional imaging, and they receive their results through their MyChart or through their physician, their ordering physician.
So, with those screenings, I'm going to kind of share a little bit of video so some of these folks can understand how how common is breast cancer in the U.S. here in East Texas specifically? How can you kind of pinpoint that?
Well, 1 in 8 women are diagnosed with breast cancer, and there will be about 300 new cases diagnosed this year with breast cancer. So there's about 30% within a lifetime that is diagnosed with breast cancer.
So how can screenings help detect breast cancer?
Screening mammograms, we're able to image the breast, and we use 3D mammography, and we also use ultrasound for dense breast tissue, and we're able to detect cancers earlier. Also, with patients who are at high risk, they can have MRIs ordered where we can detect breast cancers earlier through those screening processes.
So obviously with the process and going in and making an appointment, obviously it could be drawn out, but what age should women start going and getting their mammograms?
Well, for usually like age 40 to 74 years old, patients are recommended to have annual screening mammograms 1 to 2 years, depending on their physician, their healthcare provider, and patients should have it earlier if they have a family history or if they have predisposition with genetics.
So, I know you kind of talked about getting them earlier with those, pre-genetics, those sorts of things. Is there a certain age that even if you do have, those genetics that could be passed on, that you should start getting them?
Normally, it's really up to the physician and the recommendation of the physician, their provider. But we've seen women who can have their mammogram as soon as in their 20s, depending on their family history, what's happened in the past with their family.
And also, I know CHRISTUS Health runs a mobile mammography program. Tell us about that.
Okay. We have a fabulous mammography program, mobile services, and we reach out to our communities in the rural areas mainly, and also we are able to provide screening mammograms for patients that live in areas that don't currently provide screening mammograms. We travel to multiple clinics. We are able to see patients at their jobs. We go to a lot of businesses, and we also go to school districts so that patients don't have to leave their work in order to get their screening mammogram. We see underinsured and underserved areas, and we reach out and are just able to provide those services for patients who don't have them.
Yeah, I mean, I bet it helps too, the convenience for a lot of those folks who do have a busy schedule or they don't have the insurance. It can help them tremendously. Do you think that you've seen a lot more people get more involved with the mobile unit?
Definitely, definitely. We see about 3,400 patients per year on each of our mobiles. We have 2 mobiles at the Ross Breast Center. They are amazing units. They have 3D mammography on them. They're state-of-the-art coaches, and we're very fortunate to have those.
Okay. Well, speaking of kind of the mobile units and opportunities, there is an opportunity on Friday and free mammograms that are being provided. Tell me a little bit about those.
Sure. The Hall Family Foundation is sponsoring free mammograms for uninsured patients on Friday at Hall GMC Buick in Canton and Lindale, and we are filling that schedule up just as quickly as possible.
Oh, I mean, I bet too.
But we
And-
still have some spots available, so
Yeah, I was gonna ask.
so ladies can call our Ross Breast Center schedulers at 903-606-5433 or 903-606-5499.
So just to kind of run back over that, obviously the donor, they're covering the cost, correct? And then what other details should we know?
We have, if they just call us, we'll give them the details. They'll just need to give, normal patient information for registration, and they just need to not have insurance because we want to cover those patients that don't currently have insurance. So
Okay.
that's it.
What else should we know about Breast Cancer Awareness Month? Obviously, we're almost through October, which seems crazy to me because it feels like it was just October the 1st. But Breast Cancer Awareness Month, a lot of people don't know about what Breast Cancer Awareness Month truly means. So what else do they need to know about this?
Well, Breast Cancer Awareness Month is obviously to get awareness out about having screening mammograms and the purpose of breast cancer detection and the reason, why they need to have their screening mammograms. We have a fun-filled month at the Ross Breast Center at CHRISTUS Mother Francis. We have multiple mobile events and just serving the community and just getting the word out for people to have their annual screening mammogram because it definitely saves lives and it can also give you longer years.
Definitely.
Yeah.
Is there anything else that you'd like to share about whether it be the event on Friday or Breast Cancer Awareness Month or whatever it might be about mammograms that people should know?
I think that, patients just need to make sure that, that they're doing their annual screening mammograms on time. Check with their physician to see if they need to have earlier screenings. Always be close, trying to find out what their risk factors are and, how often they should have their mammogram. And that's about it. Okay. Give us a call. Come get your mammogram.
All right. Well, thank you so much for joining us here on East Texas Now to kind of give us a little snippet and a little tidbit about what's going on Friday and obviously October, Breast Cancer Awareness Month. It was so nice to have you.
It was nice to be here. Thank you.
All right.